I like using this. This is a center. So in this, it actually has a body that you can actually see the organs. Do you use this in anatomy? Have you used this in anatomy yet? But this also has histology too, and pathology. So we're going to look at some other things here, and with some of the things that we discussed. So what we have here, this is actually papillary thyroid carcinoma. You'll learn this about it later, but what I want to show you is sometimes it's like that. I guess I can show it to you.
IT 詳しそうです。
We'll get back to this later. I'll just show you the old slides here.
テストですよね。これまでのやつが全部出る。
先々週かな。
マスカス先生。
は多分範囲ができないのかな。でもあそこも確かレスピなんで、レスピラトリーはブロック
レスピじゃあレスピレートの方は全部ですね。
So this one is probably a lymph. Can you see the amorphous peak at the center? This is the caseous necrosis. So there's a lot of necrosis. It's very big. This is the caseous necrosis. It's one large granuloma mass. But you can see some smaller ones here on the side. Here's a smaller one. The amorphous peak center is circular structure. Let's see if you can find a better one. This is a granuloma. Here's the patient's one. Okay? The granuloma. There's a lot actually. There are several granulomas of varying sizes. There's another one here. Some of them have facial necrosis. There's another one. This one is oddly shaped. This is the caseous necrosis part. Here's the granuloma. The staining is not so good, but you can see there are nuclei in the U shape here. The staining is quite hard to see the nuclei. This is the giant cell. The staining is not good. This is an old slide. These slides are way back in 2014. In fact, they've never been used by the patho department. First time we've been using these. All this here, this pink stuff, is just caseous necrosis. No cells, everything here is dead. So that's a very large caseous necrosis area. Yeah, I'll just off to the side for the better one. That's caseous necrosis. Here's another one. You don't know this one, but I'll explain it to you. You might recognize it. This is another breast, but there's something a little bit unusual. These are they're ducts, but there are no glands, and there's a lot of stroma here. Usually you should have the breast is a little bit fatty. This is the breast of a male patient that had gynecomastia. Male breast, large one. What happens here, the ducts proliferate. So there's a proliferation of ducts, causing the breast to move. It's okay, you don't do it. Because ideally these things are just supposed to be small. They're supposed to be like the female counterpart, but the exception is there's no glands. The male breast doesn't produce milk. It just has two glands. So that's kind of unusual. There's a lot of large glands and a lot of proliferation. You don't have to know it. They're not going to come out with the exam, but just to show you. Now, this is something interesting. You see, there's a lot of regrets. Usually when I say there's review, there's only like 10 that show up. This is unexpected. Okay. The cells here are red. There's no nucleus, it's really pink. But you see that it's maintaining still its architecture. What type of necrosis is this? Coagulated. Now this is actually a testis. Okay? So what these tubules are actually your seminiferous tubules that would have the sperm cells. But in this case, this is a case of testicular torsion. So that the testis twisted, therefore cutting off the blood supply to the testis. So the cells here died due to poor blood flow. And what you see is you see a lot of hemorrhage. There are blood that are outside the blood vessels. And the cells here have died, but they maintain its shape, its architecture. This is coagulated necrosis. The diagnosis is testicular torsion. So to tell us about the hemorrhagic infarct. Testicular torsion. This is a portion of the endocervix. The endocervix is like the simple columnar oblique. Simple columnar oblique. But the problem is, in some areas, this is not simple columnar. What is it? It is stratified squamous. So this is an example of another squamous interpretation. Look here. This is not simple columnar. This is stratified squamous. But these are glands which are supposed to be seen only on the endocervical culture. So you're looking at the endocervix, but the epithelium does not match because it has been replaced. So this is squamous methylation. It's squamous methylation of the endocervix. This is the liver. What adaptive or what cell injury do you see here? Slide is damaged. Really just too low power. So what cell injury do you see here? What do these hepatocytes have? What's inside the hepatocytes? Lipid droplets. So this is called fatty change. Fatty change. Fatty change. Fatty change. This is fatty change. Remember, we have cellular swelling, and the other injury is fatty change. First off, what organ is this? Your name? What? It's the lungs. So we have something abnormal here. So we have something here. We'll look at see what it's supposed to be. No architecture. If we go to high power, most of these cells have irregular nucleus. They are neutrophils. Most of them are neutrophils, probably some dead cells. So what type of necrosis is this? No architecture. As it is liquefactive necrosis. Okay, liquefactive necrosis. This is an abscess of the lung. Lung abscess. That's full of pus inside. What is this cell that has several nuclei in a C-shape arrangement. Hang hands, So this is also granulomatous integration. We see several laying hands giant cell. And another granulomatous. Next, I will show you two slides. This is a normal tissue. I'll stress that this is a normal tissue. This is cardiac muscle. Okay? If they're branching, they have striation, intercalated disc, which you'll learn later. But compare this with this one. There's a dramatic size difference, even though I use the same magnification. I did not zoom in, I did not change the objective. Look at the size of these fibers, the muscle cells. What change happened here? Hypertrophy. So you can see the size difference. This is hypertrophy compared to the normal. You're very big. You're normal size. I'm not big. You're normal size. It's the normal. Again, same magnification. See the size difference? Hypertrophy. What are these thingies? This is? What is that? Those crystal-like things. What's that? Dystrophic calcification. This is dystrophic calcification. Dystrophic calcification. Some of them are forming nice fibroid structures, which is in your Somoma body. This is a meningioma. There's a lot of them. Okay, this is a meningioma. Alright, so that will be all for the slides. You know, we haven't used these slides in a long time, and Tamu hasn't used these slides. So for the rest of the hour, you can borrow the slides and study because you will have an exam at the end of it.